And welcome back to Living East Tennessee. I'm Kelly Smith. Thanks so much for joining us today. Well, the holidays are right around the corner. That means more time in the kitchen, more time on our feet, which means achy legs. And we are here today at the right place. If you have those achy legs, we're at Milligan Vein Clinic. Dr. John Milligan joining us today. And
thanks for having me.
Thank you so much for being here. You know, this is one of those seasons where we're all in the kitchen more, and we think this is just part of life, having those aches and pains, right?
Oh, yeah. Well, all of a sudden the family shows up, the family comes. Well, what does that mean? That means you spend more time cooking and trying to get that Thanksgiving feast ready.
Right.
But that means mom is on her feet a lot more hours than usual, especially if the kids are off to college. You're cooking, instead of cooking for two, you're cooking for a whole family.
Right.
So that's more time on your feet. When you stand still, if your directional flow valves in your veins don't work, it can make your legs heavy, tired, makes your ankles swell.
Right.
At night when you lay down, those legs will ache and cramp and severely affect your quality of life and your sleep.
Right. So many of us, you have mentioned, that we just think this is part of life as we begin to age or maybe put on a few pounds, and we learn to cope and deal with that pain, right?
Most definitely. I see that all the time. People say, oh, I've just gotten a little older, I've gained 10 or 15 pounds, and now all of a sudden my legs swell, my legs are tired, I want to go to Dollywood and sit down on the park bench rather than going around and enjoying myself. So that heavy, tired leg is really what we fix, and it's actually related to veins and not related to your age or your weight.
Right. Specifically with women, you say this is a problem for women more so than men, right?
More so than men. Men get it. They have the varicose veins and the brown legs, but women particularly get a lot of swelling and their legs ache and cramp at night. They even get the restless leg feeling. So we offer in-office treatments to fix and correct these leaky veins. But you start off with, if you're at home for Thanksgiving cooking, try to wear compression support hose.
Right.
Try to elevate your feet, and that's all we can do to kind of reverse those damaged veins until we can actually fix them. Okay,
so if you are feeling those aches and pains, the turnaround is just incredible as far as getting some procedures done and fixing those veins. It's night and day difference for the patient.
Oh, the patients frequently the next day after the procedure can say that, you know, their leg feels lighter. They haven't had any cramps since they had their procedure done. So it's once you correct that flow and increase the oxygen delivery to the leg, their quality of life really goes up quickly.
Right. You said significantly takes years off of those legs that feel so tired.
My average patient says they're somewhere between 10 to 15 years younger after they get the procedures. They're not actually younger, but
right.
Their legs feel younger.
And that's all that matters. In the end, it gives us more time to chase those grandkids or our own kids around if you're feeling those aches and pains. So when do we know it's time to come see you? What is the red flag?
It's really a quality of life issue. If you get to where you can't sleep at night because your legs ache and cramp, if you find yourself not wanting to go out with the family shopping, if you find it's a quality of life issue.
Okay, and if you head to your website, there's actually a small survey on there. You could answer a couple of quick questions and let you know if it's more than just the age or your weight gain that really needs to be fixed here, problem-wise.
Definitely. So please come check us out, milliganvein.com, and take our questionnaire and come see us and let me help you.
Right. What do you think the biggest slowdown is for a lot of folks getting this done, to pull the trigger and seeing someone and getting that vein problem fixed?
I think if they don't see the veins, they don't really realize it's a vein disease.
Right. Have no idea that that could be slowing them down. We want you back on your feet just in time to shop for Black Friday, you said.
Oh, yeah, or have more energy.
Yeah, that's the key right there. Thanks so much for all the information today. And for more information, you can head to our website at livingeasttennessee.com. We'll be right back.